Hey guys, welcome back to Defeating Hair Loss. I'm Steve, and this is Bobby D.
What's up, Steve?
Welcome back.
Thanks for having me, Steve, as always.
Once again, my model, and we're going to get into that of why you're going to be such a great model tonight, Bobby, as always.
Appreciate it.
Thank you for coming. I talk to a lot of patients that after back and forth and after research and after kind of determining that they're really good candidates, some come to this kind of question that they want me to do everything I can to talk to their doctor that they've selected because they decided with their wife or their girlfriend or their partner that they really only want to do this once. Right?
That was me at first.
So, I mean, I'm not, it's a great question. And so let's just make sure that we lay this out right, Bobby. And you're, of course, have the experience now. You could sit in this chair, do what I do because of your experience. You can't get the grafts any closer together. And that's why Bobby went for 2 procedures. Now, we've talked about it on other videos, and I've tried to talk him out of it after the first procedure. I was like, man, you look fantastic. We packed in that hairline. You look amazing. You're like a David DiMuzio clone. Your hairline looks fantastic. Why would you want to do more? And he's like, Steve, I'm the patient. I'm doing another one.
Yep.
And credit to him, his hair does look better than the first one. On a scale of 1 to 10, you may be one of the few that get very close to a 10. It's really not fair to me to give anybody a 10. Maybe that's my personality, but
fair.
Bobby, you're almost there, baby.
Trying.
Matter of fact, you might be there. The point is that we can't get the grafts closer from a surgical standpoint. This is 50% science, 50% art. You can't pay the clinic any more money to put them closer. So, you can't buy more grafts or harvest more grafts because you only want to do this once. So it's not about how many grafts that you are willing to have harvested, right? It's about how close the clinic can place those grafts, meaning the doctor creates the sites, which is really angle and direction in a 3-dimensional space. So there's more than 2 things, but I'll just point out 2 things that the doctor's doing when he designs the hairline. He wants to use special instrumentation, very fine instrumentation, that graft can go in only one way, and it's going to go in the way he wants it to grow. He's looking at your hair. Everybody has kind of different angles, different directions. The better doctors out there, the elite doctors, are going to be able to mimic the way that your hair grows out of your head. For you guys that are bald, or you girls or whatnot out there that are bald, he's going to create a new angle and direction, but obviously that's going to be natural. He or she, I should say. There's plenty of female hair transplant doctors out there. So point being is that if you have a question, if you think that, man, I got a great idea. I saw Bobby Dunlap and I've been looking at his hair and I'm watching Steve's videos and I want that, but I want to just do it one time. Well, I'm sorry. Can't help you out. Now, you could look like he did after the first procedure. You may say, wow, that's good enough for me, but don't be caught off guard. What if you don't have his type of hair in the back? What if you don't have his type of contrast or lack of contrast from his skin and his hair? What if his hair is, more wavy than yours, or yours is more wavy than his? So there's a lot of things, and this is what's kind of left out there. I mean, we can research online and we can look all this stuff up, but I know this in my blood. I've lived this my whole life, and I've gone through this. And I always wonder, well, why does this patient get this result and this patient get this result? And, they look kind of similar, but, this one looks a little bit better than this one. Well, we just never know. Results are going to vary. So again, back to the basics, right, Bobby? Like the bodybuilder, right? Squats, deadlifts, shoulder presses, bench press.
Throw a bench press in there.
Yeah, bench press in there. We want to go back to the basics. Great clinic, great doctor, low volume clinic, board certified, using microscopes, dense packing, making sure you plan on 2 procedures, and don't forget that preventative treatment.
Finasteride, yep.
Finasteride, because not only will it prevent that hair loss down the road, it'll prepare you for the fight. It'll prepare you for that procedure, creating a better zone of donor hair in order to put it in the front or anywhere on your head, could be crown, where you're losing your hair. Sound good?
Sounds good to me,
Did I leave anything out?
Not that I'm aware of.
You're the model, and I'll take that as a sign me off. Don't forget to like and subscribe.